I want to go now to Dr. Alex Jahangir of Vanderbilt University Medical Center. Of course, you know him also as the chair of Metro's Coronavirus Task Force.
There is so much to talk about tonight, Dr. Jahangir. Let's start first, though, with this discussion on this pandemic and people maybe getting the virus twice after they've suffered the first time. What can you share about that tonight?
Well, you know, it is something, as I've always said, is we don't know everything about this virus. And I've now personally heard of a person here locally that may have gotten it twice. But here's what we also want to think about is, did they really get it twice? Or is this virus similar to other viruses, such as chickenpox, which can come back as an adult as shingles, or a type of herpes that causes cold sores that goes dormant for a while and comes back? These are the types of questions that I think we need to learn. And again, this virus is not that old. And so it is somewhat concerning, because if it is coming back, that perhaps the immunity that we were thinking that getting it the first time may not be actually happening. But the other question is it really a resurgence, or is it just a virus that becomes dormant and comes back up?
It's so fascinating as we learn so much more about the virus. We know that when you get contacted by somebody, that person is a contact tracer saying, you know, you might have had the virus or come in contact with it. How many contact tracers are there now in Davidson County? How does that compare to when we started? And are they helping us move the fight forward?
Sure. So, well, it's a great question. It's very been asked a lot today, because I think it's such on people's minds right now. Because here's the thing: when we started this epidemic in March, we had 4 people on our staff who did that at health department. We now have gotten up to about 140 individuals. Plus, Dr. Caldwell has asked any of his staff who is able to chip in and do more. But 150 or whatever the number is right now, it's really hard to keep up with 700 new cases a day. And so I know Dr. Caldwell and the mayor's office are looking at, are there technologies we can use and other ways that we can really build up our ability to contact people. Even with all that said, though, I want to reassure Nashville, 79% of individuals who get this virus are contacted within the first day. So I would love that number to be greater than 90-something%, which it had been for most of this epidemic, but now we're putting 600-700 people a day on our list. It does get a little harder, but we are looking at other ways that we can expand that number of people and maybe use technology to augment what we do.
What about mental health? Let's please talk about that tonight. From people constantly worried about getting the virus to those who've tested positive and are trying to recover. What are you seeing in terms of what we need to do in the area of mental health to just keep going?
You know, this is such a hard time. I know right before this, my wife and I were actually talking about how this is causing a lot of stress on families, period. And people who... It is a big deal, and I think you've seen that in the rate of suicides have gone up, the rate of substance abuse and overdoses have gone up. It's unfortunately a sad reflection, I think, of what the stress people are feeling. What I would say is, you're not alone. If you feel stressed, if you feel like you need to reach out to someone, please do. There's the mental health cooperative. There's your primary care doctors. There's friends. You're not alone in this. Everyone's going through this, and it is such an important topic to bring up. So I'm so glad you brought that up tonight.
And there's so many facets of what you're having to deal with on a day-to-day basis with this fight, and as the chair of the Coronavirus Task Force. What would you say your biggest concern is right now?
You know, my biggest concern is that we're getting complacent. I mean, our numbers are, I mean, you've seen it, 700, 600, 500. And I think part of this is people are getting tired of doing the great things that we did as a city early on, social distancing, wearing masks. And I think this complacency is resulting in us getting the increased infections that we're getting. So this is why I want to double down our efforts. Wear a mask. You know, I saw an interesting study that came out of Goldman Sachs today that wearing a mask if by not wearing a mask, U.S. GDP can drop by 5% or $1 trillion.
Wow.
So wearing a mask is about health and safety, but it's also about our economic future. So that is what I'm most worried about, is please don't give up right now, Nashville. Keep doing the things that we need to do, because only through a community can we get through this.
Dr. Alex Jahangir tonight, thank you very much. You mentioned your wife. I know you've mentioned your kids in the past. You're a real person dealing with all of this. And you have a lot of personality that I know you're going to get to share with viewers here in just a moment. Thank you again for all of your time and for all of your work leading our task force here.